Okay, so it looks like we are ready to get going. So good morning again, everyone. Thank you for joining us for today's education session. I'm glad so many of you were able to make it. My name is Jackie and I'm a social equity representative with the Cannabis Regulatory Agency. We're happy to welcome Bahia Lee and Ebony Smith, founders of Midwest CannaNursing. Midwest CannaNursing is a holistic health and wellness education consulting company based in Detroit, serving as the intersection between healthcare, cannabis business, and cannabis-directed legislation. Midwest CannaNursing believe they have a unique perspective on the current state of cannabis here in Michigan. They also believe it's critical to offer support and guidance for all sectors that interface with cannabis. And this includes those entities interested in applying for the 2023 Marijuana Operations and Oversight Grant. The presentation will provide an overview of the grant and what education, communication, and outreach can look like. If anyone has questions during the presentation, feel free to put them into the Q&A box at the bottom of your screen. Bahia and Ebony will be sticking around after the presentation for questions. I know they have a lot of information to share with us, so go ahead and take it away.
All righty. Good morning, everyone. And thank you, Jackie, for that awesome introduction. And thank you to the CRA for hosting this educational session for us this morning. We are going to talk today a little bit about the 2023 Operation and Oversight Grant, particularly what education and outreach could look like beyond harm reduction. So without further ado, we'll get started. Information will be presented by myself and my nursing partner, Ebony Smith. So to give you a little bit of background, we are Midwest CannaNursing. Our organization is comprised of nurses, registered nurses of various backgrounds. I primarily operate in public health. Ebony's background is community nursing. We have a host of other nurses whose backgrounds are in women's health, academia, so on and so forth. And essentially we all come together, like Jackie mentioned, to offer up educational resources within the cannabis space to encourage safe and informed consumption and to advocate for patients who are ultimately choosing medicinal cannabis therapeutics. So for further context, we have a new subspecialty called cannabis nursing, and the American Cannabis Nurses Association recognizes that as a nurse that incorporates knowledge of the endocannabinoid system, safe use of cannabis, and the legal aspects of cannabis within their current practice. It's really an intersection where cannabis and healthcare is blended in a holistic way with a holistic approach. And in practice, that could look like nurses having an understanding of research and pharmacology, using that information to identify concerns and considerations for patient use through education and advocacy, part of what we're doing here today. For background, why do we do this? Where do we get our knowledge from? We actually have a credentialing body, the National Credentialing or the National State Board of Nursing has 6 essential principles of knowledge that apply for nurses, but can be generally applicable to other healthcare professionals as well. This calls that those folks have a working knowledge of the laws related to cannabis, both on a federal level and local level, as we know that those are different. This healthcare professional should also have an understanding of the endocannabinoid system, the various components of cannabis being cannabinoids and the interactions between them. We need to have an understanding of the pharmacology and research associated with medicinal use, being able to identify those concerns again. And last but not least, the number 6 is really important, being able to approach the patient without judgment and offer them support regardless of their use preferences for cannabis use. So we'll be framing this presentation today in the context of these 6 principles of essential knowledge. Going right into our objectives, first, we want everyone to be familiar with the Michigan Operation and Oversight Grant, things that have been done in the past, and the need for education initiatives. We want to identify areas for more comprehensive cannabis education, communication, and outreach. And lastly, understanding the impact, the benefits of giving out this education and advocating for patients and ultimately incorporating this information into our current practice. So when it comes to the Operation and Oversight Grant, there's a $3 million pool that is available to counties to do education, communication, and outreach related to medical marijuana and also adult use marijuana here in the state of Michigan. When we think about why cannabis education is needed, it's important for a couple different reasons, and the reasons may vary depending on what sector you're coming from. So when we think about healthcare, we know that overall there's changing perception as it relates to cannabis since we have legalization. It's been a big thing in our state. It's more accessible. Patients and consumers in general are curious as to what cannabis is and the effects that it can have on their health. What we need to realize as a healthcare society is that cannabis is neither a panacea, it's not a one answer cure all for ailments, but it's also not on the opposite spectrum, being the evil that we know from prohibition and reefer madness. On the business side of things, we often find that cannabis consumers are navigating its use with limited guidance by qualified professionals. And if you think about the background of cannabis entering on the scene and emerging as a holistic medicinal therapy, it's a little bit concerning when we're saying that folks are pursuing this without guidance. And last but not least, if you're coming from a legislative background, you've been working diligently on these laws, practice and regulation is ever changing, but we do have some gaps in translating what that actually looks like for the consumers that the laws are ultimately established for. So we know that the effects of cannabis vary by person to person. And as we mentioned last slide, there's a little bit of a limited support system for patients when they're making informed decisions about cannabis. And we actually have a little bit of research that came right from our backyard here in Michigan that surveyed medical cannabis patients. And we found that about 86% of these patients are supplementing cannabis for their prescribed medications. However, a little under half of them are not informing their primary care provider. So again, we're having that gap in communication, that gap in translating these laws into practice, and ultimately we're seeing that patients are not having guidance. Well, when we look at the reasons for that, we found that there's no consistent education about cannabis, its evolving laws, research, and practices. So consumers feel unsure of who they can turn to get this information. We have another study that was done here in our backyard that pretty much backs up that information to say that in talking to and surveying cannabis patients, only about 21% of them were confident in their primary care provider's ability to integrate medical cannabis into their regimen. So again, we have the context of why we're seeing the gap of patients communicating with their providers about their choice to use medical cannabis. So an opportunity to mitigate some of this gap in communication, gaps in education is the Operation and Oversight Grant, again, used for education, communication, and outreach about medical cannabis. So there's an application process for these funds. Applications are due by January 1st, so right at the top of the year. And in addition to filling out the short application form, the CRA wants you to describe your project and your implementation plan. They heavily encourage efforts to coordinate with other agencies, whether that be counties or pertinent partnering agencies within your municipality. You want to describe the impact that the funds are going to have on the community and your anticipated accomplishments. You want to show a detailed budget, exactly what the funds are going to be used for. And last but not least, any anticipated outcomes that you feel will arise from the efforts put forth under the grant. So when we take a look at past year's efforts and what has already been done, we're seeing a lot of messaging around harm reduction. So that can be broken into 4 different categories. I think that a couple years ago, the counties got together and came up with some areas of uniform messaging that could go forward across the state. And that pertains to youth access and consumption, safe storage, driving under the influence of cannabis, and last but not least, pregnancy and breastfeeding. The pictures on the screen, you'll see areas of how this education was put forth within the community. Some of them have been on billboards, other on bus advertisements. And lastly, you'll see 2 pictures here of safe storage containers that were actually distributed in certain communities to help progress the effort as well. Now, these are examples of the in-person written messages that were shared. However, this next slide goes into the same themes of harm reduction with those 4 subcategories. However, these were digital campaigns. So you again see the county's efforts of trying to use multiple modalities of communication to reach their targeted audiences. Some of these were websites that actually offered up the opportunity to connect and get more guidance and information. Some of them were Snapchat campaigns. Again, the overall messaging here were the 4 points that were really strong, and meeting the consumers where they are, putting these messages in places that are readily accessible for the people who need them the most. Taking a look at the past grant year cycles, we'll focus on this diagram on the left-hand side first. This shows you the amount of participation by the counties over the past 4 years. We know that there are 83 counties that medical marijuana patients reside in. And over the past years, we've seen that maybe about 50 out of the 83 of those are actually participating in the grant. So there's some opportunity to get more counties involved, especially because, again, they have those residents who are using medical marijuana and could benefit from this information. On the right-hand side, we show the actual grant fund usage. Recall back a couple slides ago, we said that the total pool of grant funds each year is $3 million. You'll see at the last bar for each year, we're pointing out how much of these grant funds were actually spent. And we're looking at just about half of that 3 million each year, which means that we're leaving a lot of unused funds, which translates to a lot of missed opportunity for education amongst consumers. So taking a look at, well, why didn't counties apply, or why weren't the grant funds used? We have identified a couple barriers just for you to be aware of when you're going forward into the 2023 grant cycle. So we noticed that there were no dedicated staff, meaning counties were using internal folks to develop the plan and put forth the resources that they had planned out. But these non-dedicated staff are also working on other concurrent public health issues. So over the past years, we've had COVID, we've had monkeypox, and when those things arise, it takes away from the opportunity to be able to focus on the cannabis education. So a lot of times it gets lost in translation. We're also noticing that there's limited knowledge of laws and cannabinoid therapeutics amongst the staff that is able to work on the grant. So there's gaps in knowledge there. We're expecting folks to put out public health messaging about cannabis who do not have an extensive background on cannabis therapeutics and all of the concerns and considerations for it in the first place. There's also been an issue with counties connecting with provisioning centers and adult use retailers, which again, that line of communication is very important, because going to the next point, the counties need to be able to reach the medical cannabis patients and consumers. So bridging that gap of meeting the consumers where they are, which at this point is likely in the provisioning centers and adult use retailers, is something that we really need to work on for the upcoming year. And last but not least, the length of the grant cycle has proven to be a barrier where it limits the continuation of these education and outreach activities throughout the year. So we ultimately are kind of stopping, putting down our work on cannabis and then picking it back up. And it almost is like we're starting from the top and we lose a little bit of time in getting our messaging across. So looking ahead to 2023 and what the possibilities could look like for this grant, there's a little bit different or a little bit of a change in the foundation of the Operation and Oversight grant, namely being that in prior years, this was strictly education and outreach on the 2008 Medical Act, with the MRTMA being added in there, which again is for adult use. There's a lot more expanded opportunities of just the messaging in general that can be put out by the counties. In prior experience working with some of the health departments, there was concern from not only the staff, but administration about what messaging was okay and what messaging was actually able to put out. And of course, counties didn't want to encourage consumption, rather educate about it. So there's a little caveat that was written in the recent bill signed by President Biden, the Medical Marijuana and CBD Research Expansion Act, also known as the Cannabis Research Bill, that says physicians may discuss the potential risks and benefits of marijuana and CBD with their patients. So just that alone opens up our opportunity of what we can educate about related to cannabis and feel comfortable in doing so as it relates to our licenses, funding that our facilities are receiving, and so on. So when we're talking about goals for 2023 and what we hope this education could look like, we have a couple initiatives here that we really want the counties to hone in and focus on. The first being expanding public health education amongst both the cannabis industry, so your consumers, your bud tenders, anyone who interfaces with medical cannabis patients, including the healthcare community, those providers, those social workers, the public health staff at the counties. We want you all to be educated. We also want to see counties champion above and beyond our usual harm reduction, education, and outreach activities. So while we have those 4 categories that we're focusing on, we're hoping at the new year that these categories will be expanded and encompassing of some of the messages that are appropriate for those participating in adult use cannabis. And last but not least, that leads us into our ultimate efforts of, regardless of whether someone is choosing to use cannabis or not, if they make the choice to consume it, we want to make sure that they are consuming it safely and in an informed way. So we actually pulled out some examples from the past years of counties who put forth some great efforts that are progressive, that are already sort of above and beyond. We want to highlight that for those counties who may be considering a little bit of a different approach as the new grant cycle is upon us. So taking a look at Washtenaw County, for the past 4 years, they've done an awesome webinar that's targeted at healthcare providers that address concerns that providers have about cannabis use with their patients. And they also take a step to address some just industry things that are going on that may be relative to healthcare as well. So we have presentations about social equity. We have presentations about veterans' use of cannabis, cannabis for chronic pain. And we also see notes of some of those harm reduction techniques that we're already focusing on, like cannabis use in adolescence and in pregnancy. On the right hand, you'll see a flyer that was a support effort from Oakland County with a Wayne State University nursing student who put together a webinar educational event encompassing of a live panel Q&A to, again, prepare providers to work with patients who are using medical cannabis. So in the new year, we'd love to see opportunities for more expanded education. As we know, many of our healthcare providers do not receive this education in their traditional curriculum or programs of study. Another great example from Baraga and Osceola County in 2019 and 2020, they also did some education. However, theirs was community-based, right? It was for healthcare providers, but it was also for any residents that could benefit from the information. And this was awesome because this county actually partnered with an organization that was operated by a cannabis nurse who had an extensive background on cannabis, palliative care, and just medical cannabis therapeutics in general. So what they were able to do was create a video, a handout, and do in-person presentations on the topics that you'll see below or on the screen, sorry. So the safety of cannabis, the rights of patients and caregivers, their responsibilities. They went over the laws. They touched on some of the qualifying conditions, ethical issues. They educated on the endocannabinoid system. And they also talked about the history of cannabis and the prior uses of marijuana and hemp. So you can see that this is a very comprehensive overview of cannabis and takes a unique approach to educating the community. And they also put out a cannabis literacy questionnaire, which was essentially a pre and post test to assess the effectiveness of this educational intervention. And again, not only was this important for delivering the actual education, but it also gave important baseline statistics of how to guide outreach and education efforts in the future. Another couple of honorable mentions that we like in terms of harm reduction messaging came from Washtenaw County. Once again, they created this fast fact sheet that you'll see on the left that goes over both medical and recreational marijuana. You'll see the 4 points of harm reduction incorporated in there of, for pregnancy and driving and youth and safe storage, but you also see the notes of adult use information in there. So going over those medical cannabis laws and what they mean for people who are over 21 in the state. They have information here saying protect your lungs, giving alternatives to smoking and vaping, which really gives the foundation that there are other routes of administration for cannabis and what considerations there are for using those. To the right, you'll see a guide for parents for teen marijuana use, which is very important. We understand that those under 25 should not really be consuming cannabis for fear out of the effects of on their brain. However, what do we do with this information once the parents receives them? What do they do with the information and how do they communicate with their child about that? This graphic really gives not only the background, but gives some tips, and it just is a comprehensive way of approaching this harm reduction messaging.
So as we continue to move forward in 2023, focusing on expanding harm reduction messages, we have some examples here we would like to share with you all. Hopefully this will be a starting point for you to take back and expand on and hopefully increase your efforts. So we do know that cannabis has been used for these particular chronic conditions. Here in this research article, it basically supports that the use of cannabis is safe and it is therapeutic. We do know that according to the 2017 NASEM report, that these specific chronic conditions have sufficient evidence that we can support our patients and guide them in as they look to use this as cannabis. As we are counseling our patients about cannabis, we want to ensure that we are focusing on additional precautions. We want to make sure that we are targeting those groups who we probably have not mentioned in the past. So we in the past have definitely focused on youth messaging, making sure that our youth audience is not consuming cannabis. We talk about how pregnancy and those who are desiring to become pregnant should not use cannabis. But what we don't typically focus on and what we have not seen in the past is those contraindications as it relates to mental health. We do know that studies show that those folks who have a history of mental health illness have a family history of mental health illness, specifically your schizophrenia, severe anxiety, and/or psychosis, those would be reasons why we would not recommend cannabis. So just making sure your messaging is well-rounded. We want to make sure that we're targeting all populations, those who can consume cannabis and also those who can't. We want to make sure that we are mitigating those adverse reactions that we typically see when patients are consuming and do not have that guidance. So as states continue to legalize the use of cannabis, we want to make sure our healthcare professionals and our pharmacists are all aware of how to counsel these patients who are deciding to use cannabis. I also have here just some common adverse reactions that typically are connected to cannabis, whether it is inhaled or any other type of formulation. So that could be your headache, your dizziness, and dry eyes. What we do know is the most common non-serious side effect for cannabis use is typically dizziness. So that's something that we want to make sure that we're focusing on, highlighting how cannabis, yes, it is a medication that we can use for benefit, but we also want to recognize that there is potential for misuse, overuse, and harm that can be related to that.
Absolutely. And I just want to add in this point, we have a reference for this article, but this article is good because it has a chart in there that really succinctly explains tips for indication, dosaging, as well as the precautions, contraindications, adverse effects that you'll see on the screen. So definitely reference that table to support your messaging point.
As we're continuing to expand our harm reduction messaging, these are additional examples of how one could essentially have this conversation with their doctor, their medical provider. Like was expressed earlier, Nurse Bahia mentioned that a large majority of folks who are using cannabis are not consulting with their primary care provider. Like was mentioned, 86% of those patients are using cannabis in place of prescribed medications. So we want to just highly encourage that persons who are seeking to use cannabis, our consumers who are looking to use it for adult use, are still communicating this desire with their healthcare provider. We want to make sure that they are addressing their concerns, whether or not they are substituting their prescriptions for cannabis. We are hopeful that this is something that will ultimately reduce the likelihood of poor outcomes for patients who are essentially self-medicating without any guidance. As patients are continuing on their journey, it is also helpful to encourage patients to track their cannabis consumption. So you need to know what it is that you're taking. So it's definitely helpful for patients to have either a written journal or perhaps using an app like Jointly, where they're able to track the products that they use, their responses to those products, how much is needed, and the effects of that. This ultimately will allow them to essentially express how cannabis has been useful in their medical journey, and be able to support this with their healthcare providers. Continuing on, this is an example of how we can go above and beyond messaging for our consumers and healthcare community alike. So we do know that with cannabis being legal on a state level, that allows for folks to consume those products. However, there are some caveats. Because cannabis is still federally illegal, there are some potential impacts on a employee's job security. There is the likelihood of still patients or consumers being tested for marijuana, for cannabis. And what we do know is that these laws do not protect those patients or consumers from losing their jobs. So just making sure that messaging also expands across the result of using cannabis and how it can affect one's livelihood. On the right, there is a great example of how a training was offered, and this was through the Michigan Public Health Institute. We essentially saw that healthcare providers were targeted. Those who typically engage with patients are being encouraged to look at the child protection laws. We are seeing that there is an increase in implicit bias as it relates to those folks who are deciding to use cannabis. In specific for this training, the conversation was surrounding expectant moms and those who are recently delivered. So during that training, there was a lot of conversation revolving around cannabis, even though the training was for substance use. We saw that cannabis is probably the most common illicit substance that is used and typically is found in UDS screenings. And usually what we're seeing is those medical providers, your nurses, your social workers are actually reporting these patients to CPS for those positive drug screenings. During that training, those same reporters were actually discouraged for doing that. We want to make sure that we are reaching out to CPS for reasons that are related to neglect, reasons that are potentially related to abuse, and not just substance use alone. This is a great sample of how safe and informed consumption messaging can be used and expanded upon. Like was mentioned, we do know that since legalization in 2018, ER visits have increased. We are seeing folks come in for overindulgence. We're seeing folks come in with cannabis toxicity, and specific, we're seeing minors and youth getting into their parents' medicine, their cannabis products. So we want to offer up some education as to how safe and informed consumption can continue to educate those patients and make sure that we're not seeing those visits to the ER or those situations of overindulgence. What we do know, and according to McCallum and Russo, that cannabis is much more therapeutic when it's taken in smaller doses. So that's something definitely to focus on when drafting and crafting out your messages when you are targeting consumers. Making a point to know that less is always a great way to start. We know that typically when you're using cannabis in a smaller dose, you're going to have less likelihood of tolerance, and you're typically going to have less likelihood of those negative effects. As patients are using cannabis, we know that it is an individual experience. So just making sure that patients know to take their medication at the lowest amount necessary, taking time to see whether or not that medication or that cannabis product is working effectively before they are looking to increase that use. We definitely encourage patients to go with the model of microdosing, meaning less is more. We want to make sure that these folks are able to access information that makes sense. So to your right, we do show how our information can be presented in layman's terms. You see a graph here where it talks about finding your sweet spot in that therapeutic window. So offering up ways that patients can take this information and receive it and also ultimately make better and safe informed decisions. As we continue to talk about examples of how we can expand our messaging and go above and beyond harm reduction, this is a great example of why patients should be purchasing their products from a reputable source. We have here on the right a sample of what a certificate of analysis is, and this essentially gives the patient opportunity to do a deep dive into what products they're using. It allows them to see what is actually in their products. It also shows that these products have been tested, that it is free of any lead, any heavy metal, any bacteria that could cause further harm. So with this messaging, we want to continue to encourage our patients and our consumers to go to a place that is reputable, go to a place that is licensed, and also take it a step further when you're in those spaces to ask about those products. Perhaps you can ask your bud tenders, hey, do you have a certificate of analysis that I can look at and see what is in those products? Doing this will allow for patients to feel more empowered, and ultimately, we're hoping that this will decrease the likelihood of any adverse reactions.
Just want to add in here another note about considering the onset time for selected products and just the various considerations for each route of administration. A lot of times when we're looking at messaging, we're looking at inhaled forms of cannabis. We know that oral consumption is becoming a big thing with our gummies and various other edible cannabis products. So making sure that we are sending the messaging about onset time, just about dosing, and again, knowing exactly the components of your cannabis products is very, very an important key to safe and informed consumptions when we're trying to mitigate those adverse effects.
So as we continue to expand these efforts, there are benefits to the public health that we want to acknowledge. So as we continue to put forth education that is concise, education that is consistent, the ultimate goal is to reduce harm. We want to essentially reduce harm that could occur in those contraindicated populations. So for those folks who shouldn't be using cannabis, we want that to be something that is targeted. We want to make sure that those folks who can refer to using something else should know that that is an option. We also want to make sure that our consumers and our patients are having safe and informed consumption. And through this messaging, we're allowed to do that. As you continue to expand these efforts, there is the likelihood to garner more research in the field. You have an opportunity to connect with folks who you typically wouldn't. As doing this work, focusing on folks who are typically harmed and live in disproportionately impacted communities, you're able to hear what their stories are, the reasons why they are consuming. It offers a wider picture, and I think it allows for folks to ultimately decrease that stigma that is tied to cannabis use. It definitely allows for our healthcare professionals to essentially do their due diligence, make sure that they are a non-judgmental space, make sure that they are offering up opportunities for patients to explore their desire to use cannabis. So not only does counties and communities benefit from this education, we do see that businesses can also benefit. As businesses continue to work in hand with these leaders in the community, whether it's public health, research, or healthcare providers, it gives them, like I said, an opportunity to expand their reach. It definitely offers up the notion that they are considerate and know that these patients should be educated and informed before using their products. It also allows for them to create a loyal customer base. It allows for them to essentially promote products that are based off of this research that has been used and pulled in from these education efforts. It definitely allows for these businesses to expand some of the products that they're using and make sure that they're targeting the needs of the patient. So as we start to look at how this can go hand in hand with some of our businesses who are licensed, the CRA, Social Equity All-Star Program, actually encourages their participation and allowing these organizations to work with these communities. So it's encouraged that these businesses connect and reinvest in communities that are typically disproportionately impacted by marijuana prohibition. This allows for businesses to essentially showcase their efforts and the work that they have done thus far with working with said healthcare organizations and communities. It definitely allows for them to reinvest in those communities, uplift those communities, and continue to support the voices and the needs that these particular folks are in need of. So as we wrap up, we definitely talked about a lot of things today. So some of the key points were that we want to make sure that our staff is trained, that there is consistent education across the board for our healthcare providers, our healthcare professionals, and the industry alike. We want to make sure that folks are educated on just the general guidelines, the basic information as it relates to cannabis, and taking it a step further, we want to make sure that they are informed of why patients shouldn't take it, why patients shouldn't consume cannabis, and knowing what those adverse effects can be. We also talked about how workplace testing and UDS testing in general can affect one's livelihood. We know that folks can lose employment. There is likelihood of parents being reported to CPS because of their use. So making sure that messaging also targets that community who is typically harmed. We also talked about how you can have this conversation with your medical provider. We want to encourage and empower our patients and consumers to the point where they feel they can share what they are doing with their providers. And that way they're having some support, some guidance in their use from a healthcare professional. We also talked about why it's important to track your usage. We want to make sure that patients are using medication that's going to work. We want to make sure that we are lessening those risks of overindulgence and cannabis toxicity. And the last few things that we talked about, we want to make sure that messaging is educating our consumers and making sure that the importance of getting information before you decide to consume cannabis should be the first step. We encourage our patients to seek out certificates of analysis. We want our patients to purchase their products from reputable sources, all as a way for us to mitigate and to eliminate those adverse effects. And lastly, we focus on the impact of expanding public health education. We talked about how collaborating between healthcare professionals and cannabis businesses can be mutually beneficial and ultimately serving the patient's needs. And lastly, we talked about how the CRA Social Equity All-Star Program can be a way for cannabis businesses to showcase these efforts of how they have reinvested into these communities in which they serve. We wanted to share with you all some resources for education and outreach activities. These are tried and true resources that you can take a dive into and look more into and get additional information. We also have local organizations here to your right. These are organizations that are here in your state of Michigan who can assist, support these efforts of education and outreach. Your Midwest CannaNursing Consulting, your CannabisNurse.com, and also the Michigan chapter of Americans for Safe Access.
Yep, just want to point out these written resources were absolutely used throughout this presentation, but we encourage you to search for these articles and or resource and keep them on hand as a way to provide some guidance to that the staff that is going to be responsible for implementing the programs under the grant.
And more resources and references that were used. And we are done. We would like to thank you all for staying on and giving us your undivided attention. Feel free to reach out if you have any additional questions or comments after digesting all of this information. And we're happy to have been here to offer up this information, and hopefully it was helpful.
Great, thank you guys for sharing this information. If you would like access to this presentation at a later date, you will find it on the Social Equity webpage under Video Resource Library within about a week. So today we're going to jump right into the Q&A. So please send us any questions if you haven't done so already. If a question you submitted doesn't get answered or you think of something later, please feel free to submit those to our social equity team at CRA-socialequity@michigan.gov. So it looks like we have one question. Can we have some specific examples of agencies to reach out to, please?
Yep, so I saw this message. I want to say this is coming from someone on the side of the cannabis industry. I think I've seen that name before. I would encourage you, first and foremost, since this grant is only available to counties, to reach out to the county within your area of practice. So whether that is the Detroit-Wayne Integrated Health Network. I believe they were one of the ones between them and the Detroit Health Department who are responsible for applying for the grants in the previous years. We've got your Oakland County Health Department, your Washtenaw County Health Department. You would start there, and from there, they would actually have a list of community partners that they interface with that are very interested in this information. So a lot of those community partners are agencies that work with families. There are some that are focused on youth services. There are some that are focused on specifically rehabilitating family and environment situation for those who have been incarcerated. So first stop would be, I would say, to reach out to the actual county departments so that you can get in contact with their specific community partners.
Okay, and we had another one come in. I'm just going to read it word for word. Many HCP discriminate against cannabis users and even discharge people for using cannabis. How can patients feel comfortable speaking to their HCP with the continued discrimination?
Well, that's a very good question. And unfortunately, we do have to agree with you that the conversation is made very difficult because of the cannabis provider being against, the healthcare provider being against cannabis use. But again, that's why one of the first things that we recommended started with educating the healthcare providers. A lot of healthcare providers are against cannabis use, first and foremost, because of ignorance, and that simply meaning having the lack of knowledge. So we want to encourage them to find out about this information, to comb through the evidence base that we have, because we do have thousands of studies that support the use of cannabinoid therapeutics. But beyond that, it's also recognizing that, every provider, depending on what their specialty, is going to have a different recommendation about cannabis. If we're talking to a provider that is a pediatric provider with the youth, or maybe someone who works in obstetrics and gynecology, those folks are going to have different cannabis messaging always as compared to someone in oncology, perhaps. But what we have to know and do is be persistent in addressing our right, or the person's right, to use cannabis as medicine, and making sure that their provider is on board to do so. So if that involves walking into your provider's office with a stack of research papers, maybe taking notes on articles that they can refer to where you've gotten this information from, would all be helpful in having this conversation. It is ultimately something that is going to present a lot of barriers. However, those things can be mitigated by coming through with the appropriate resources and just being your own advocate. Ebony mentioned about consumption tracking. If that's something that you are able to do in your journey, but being able to track the benefits, the adverse reactions of what you're experiencing using cannabis to treat your ailment are all helpful things to do when talking to your provider. And we mentioned that Americans for Safe Access tool, they have a whole packet that's for cannabis patients. And in there is a nice reference of those tips on how you actually talk to your provider. But being direct, treating this cannabis as if it's no different than the Motrin that you take for a headache, or, you know, the Pepto-Bismol that you take for a stomach ache. You have to decrease the stigma from your own perspective in order to have that open conversation with your provider.
Okay, great. And it looks like we have some comments that I will be happy to forward. But it looks like no more questions. Let's see. Oh, wait, there is one that says, are we able to find out what counties previously received grants? And you can actually go to the CRA website, and it's michigan.gov/CRA/grants/grant. And that gives you the history. It looks like going all the way back to 2016. So hopefully that answers that question. So like I said, the comments we can forward. It looks like that is it though. So I think we are ready to close it out. So thanks again, everyone, for joining us today for our CRA education session. And a special thank you to Bahia and Ebony for their time and this information. Please check our calendar on our social equity webpage for upcoming sessions in 2023. We appreciate the participation and wish everyone a happy new year. Thanks.